Hi, hopefully everyone can hear me. Okay, great. So thank you so much for joining us today. For those of you who just entered, there are some things I would like for you to keep in mind. Currently, all participants are on mute, and this is just so that there aren't any overlapping voices or noise during the town hall. And we'll be unmuting participants when they raise their hands to ask questions. Going off of that, if you would really quickly familiarize yourself with the raise hand function on Zoom. I did send a PDF around with instructions and pictures, but if you need any help, you can go ahead and send me a message through the chat function right now. And if you can't find the chat function either and your camera is on and you need help, if you could go ahead and wave your hand so I can unmute you and kind of go over the how-to. Okay, I'm looking through. I'm not sure if there are anyone. Okay, but let me go over it just one more time so that people do know. If you are on a computer, what you need to do is on the bottom of your screen, there should be a button that says participants, chat, share screen, record, and reactions. On the very left, if you click on the participants button, a window should pop up with a list of participants. From there, if you look at the lower right hand, you'll see a little raise hand button. If you want to raise your hand to ask a question, you'll need to click on that button. If you're on a phone, what you need to do is go ahead and look on the bottom right of your screen. There should be three dots, and then it says more. If you click on that, a window will pop up, and there you'll see the raise hand button there as well. And hopefully everyone knows how to raise their hands now. Okay, great. I see that someone has started raising their hands. Okay. I think by now everyone has joined. So now I am going to go ahead and introduce the congressman who will first give his opening remarks, and then afterwards we will go ahead and invite the audience to ask any question that you may have. So Congressman, if you will.
Hello everyone, how you doing? I hope you are all staying safe and healthy and following the CDC guidelines to make sure you practice social distancing and washing your hands and doing everything that we need to do to keep each other safe. I want to thank you all for joining me for Cisneros in Your City Fullerton Town Hall. Over the next hour, I'll do my best to answer your questions. I want to focus on the coronavirus pandemic, the federal government's response, and, like I said, answer your questions live. On the website, my website, you'll find information, resources, and FAQs on the crisis. As more people continue to get onto our town hall, I want to take a moment and talk about the work that my team and I have been doing here for the 39th Congressional District. We've responded to nearly 1,000 calls and voicemails throughout the crisis from constituents who need help and support. We've been able to bring back over $131 million in coronavirus aid to our cities, the county, health centers, students, universities, and our colleges. Congress has passed 4 bipartisan coronavirus response bills aimed at supporting our workers, families, healthcare workers, and small businesses. And right now we're working on a 5th bill to provide more relief for our workers, small businesses, our cities, and our states, and to make sure that we continue to provide more funding for testing. We're focusing on long-term relief right now. That's to ensure that we continue down this path of recovery. Just a few ground rules for the town hall here. If you have a question, you can use your raise your hand function on Zoom. click on the participant tab at the bottom and you'll see the raise hand button on the bottom right, and one of my staff will call on you. Unfortunately, if you're dialing in, you won't be able to use the raise your hand feature. When asking your question, please be respectful and do not use profanity. My kids may pop into this room at any time, so I don't want them to hear any words that they shouldn't hear. I know you all have a lot of questions, so we'll go ahead and get started. Let's take those questions.
The first question we have is from a Jeff G or Jeff G. And you are unmuted right now. If you could go ahead and ask your question.
Hi there. Thank you for having this. I appreciate you for taking the time to answer my question. My question is, do you believe Tara Reid?
Do I believe Tara Reid?
Yes.
You know, I believe every individual has the right to speak up and to know about anything that's going on. You know, all victims of sexual harassment, sexual assault need to be heard, and I support that fully. You know, I think we need to hear her, right? And then it needs to be looked into as far as what the facts are and to what happened, and it needs to be investigated.
Great. We'll move on to the next question. Tiffany, did you know someone who had their hand up?
Yes, we have Rosalie and Brian on the line. And you are unmuted.
Yeah, hi. We had questions about whether or not St. Jude Medical Center has remdesivir and or hydroxychloroquine in stock, and whether they're administering those types of drugs in case somebody is infected and has to go to the hospital.
Well, I don't have an accurate account of what prescriptions that they have available there. I do know the hydroxychloroquine, and excuse me if I mispronounce that right. That's a drug that's typically been used to treat those with rheumatism and lupus. There was some earlier research that was being done on that drug. Early results haven't been that great. I know that it's something that the president has been pushing, but from the research that's been done, it really hasn't had that positive of results. You know, these are prescriptions, or these are drugs that are really needed for those patients. And for a while there, my mother-in-law, who does suffer from lupus, who has to take this patient, was having trouble getting this prescription because so many people were trying to get their hands on it because they thought it was going to be the miracle cure. Unfortunately, the science and the research hasn't shown that. So we are continuing to do research on this. NIH is funding research. CDC is funding research. The Department of Defense is doing research. I was on a call today talking about the research that the Department of Defense is doing in response to the COVID-19 crisis. And so they are partnering with numerous universities, working on a vaccine as well as working on a treatment. And you know, we will continue to make progress on this. We're finding new things about the virus every day. You know, I don't know if you saw in the newspapers the other day that right now they've discovered there's 2 different strands. That, you know, one that came in through Asia, and one that had gone through Europe, and you know, the strand could be mutating. One of the questions that we talked about today was, would this kind of the mutation really cause a delay in creating the virus? And right now they don't think it will, but you know, they're continuing to do this research, and we will, hopefully, you know, hopefully sooner than later, we will have both a vaccine and a treatment.
Great. Thank you so much for your question. Tiffany, do you know who we got up next for us?
Yes, we have Kevin Nikusanti. Let me unmute you right now. Okay, and go ahead.
Hi, thanks, Congressman, for taking the time. I'm in Fullerton.
Mhm.
I have a question a little off, but somewhat related to job destruction. Big news is flying around about USPS perhaps going down, maybe needs a massive bailout. I run a internet e-commerce company, and you can imagine it would be completely destructive. I heard the president say things like it could go 3 to 4 times for a price increase, which would destroy thousands of businesses, including mine. I
Mhm.
wanted to know from you, what is I'll call it the legislative process, the lobbying process? How do we see DC churning through this to actually make a legitimate battle or finally deal with it and reconstruct it? It's such a financial mess.
Well, the post office is, it's an organization that's been around since the beginning of the country. Ben Franklin was the first postmaster general. It's an institution that we need to make sure continues to stay around. The House of Representatives has been very forthgoing in trying to make sure that we get funding for the post office to help it through this crisis. It's a business. It operates like a business, just like any other business. It doesn't receive any subsidies from the federal government, nor it has to be self-sufficient. But right now, it's struggling just like many of our businesses are struggling, and it needs help and it needs support. And we have been working to try and find a solution to this. Unfortunately, on the Senate side and in the administration, they have not been very cooperative. And as you said, right, the president has been very vocal about what he thinks the post office should do, that they need to charge higher rates. The post office keeps pushing back. But, I am in fully support of the post office. I know how important it is. I know how important it is to our country to make sure that mail gets to those rural areas. Companies like, FedEx and UPS use the post office as well. Amazon uses the post office, well too, to get their packages everywhere. So we will continue to advocate. I will continue to advocate for support to the post office. I have a cousin that's a mail carrier. My godfather was a mail carrier. And these are workers that, are going out there every day to make sure that the mail is delivered, regardless of the conditions. And we always, rain, sleet, or snow. But right now, even with the coronavirus, and many people are being asked to stay in place, our mail carriers are still going out there every day to make sure that the mail is delivered. And we need to support them. To lose the post office would be devastating and would add so many people to the unemployment rolls when we have millions applying for unemployment right now. So like I said, I will continue to advocate for the post office and make sure that it gets the funding so that it can survive.
Great. Thank you so much, Congressman. Tiffany, who's our next question?
We have a Michael, no last name, and you are unmuted right now.
Good afternoon, Gil. I have a question with regards to unemployment and payroll protection plan.
Mm-hmm.
My wife, here, let me have her ask you.
Hello? I can't hear you. Sorry, technical difficulty. My question, which I think probably many people have the same situation, is when our children were put out of school, most of us were also furloughed. So my children had childcare because I was home with them. Now that my employer has been approved for the payroll protection plan, I'll be going back to work, but my children don't have childcare. I know that in some circumstances, unemployment will still be in effect, but there's really no way to find out. There's no way to get in touch with anybody, no practical way. And so really people in my situation, we're just kind of stuck because if we don't go back to work, we don't qualify for anything anyway. And if we do go back to work, our children are just home. I mean, I don't know what to do with my children. Any thoughts on that, or any? can't hear him at all.
Hold on, we just
There we go. I was muted. Now I'm back. No, this is an issue. You know, I have a friend of mine that I used to work with that is, you know, she works for the county of San Bernardino and is basically been working this whole time, and while her kids have been away from, you know, home at school, or well, not in school but home because school is out, and so she's had to rely on her husband and her mother to help out, and really her older daughter has kind of picked up a lot of the slack, is really kind of helping to help her younger daughter. You know, it's an unfortunate situation, and I know we approved early on some of the FMLA so that people could go out there and take the family leave when they need it to really to help an individual as well as to stay home with their children. But you know, that wasn't meant to be for a very long extended portion of time. You know, childcare is something that we need to keep advocating for, and it's something that we had actually sent out a letter just recently saying that we need to help fund childcare programs. You know, in part of phase 2 of the governor issued that childcare facilities need to increase capacity in conjunction with reopening of businesses. And so it's an issue that I know many families are struggling with, especially as businesses start to open up as we move through the different phases according to Governor Newsom's plan. But we still know schools are on the far end of that phase. You know, those are one of the last phases because just having so many individuals or children congregated in such tight areas, they're on a school, in a classroom, or on a campus. We still don't know if that's possible or safe yet, and so we need to make sure that we practice the social distancing there at the schools. But you know, it's an issue we're aware of, and like I said, we've sent that letter advocating for you know, more childcare, and the governor is making sure that childcare facilities will continue to open up as we increase businesses, or as businesses open up. And so, but continue to work with our office, and as more resources become available, we will point them, we will make you aware of them, of how you can handle this problem with you know, your children.
Great, thank you so much, Congressman. Tiffany, who's next on our question list?
We have Nita Armstrong. Nita Armstrong, and you are not on mute anymore.
Thank you so much. Thank you, Congressman. I appreciate your time. I have a question about testing. My healthcare provider has been great with giving us information for those that are symptomatic and how they can receive testing.
Mm-hmm.
It's been great to see Los Angeles County testing anyone, whether they have symptoms, they don't, or to see if they have antibodies. I was really frustrated and frankly concerned with the Orange County Board of Supervisors focusing on beach closures or opening up beaches, when I feel like this county needs to focus on testing. I read in the Register that this county has only done 43,000 tests, and I'm just wondering, on a federal level, what can you tell us, update us on how do we get more tests in this county so we know exactly what we have on our hands here?
Well, believe me, I feel your frustration. I've been frustrated as well. And this is something we've been pushing back on Orange County on, to make sure that they need to expand testing. Congress has allocated $25 billion in our last package that we passed. $25 billion was going to increase testing throughout the country. Tomorrow I have a call with the person in charge of the Orange County Public Health who oversees the testing. And that's going to be one of the questions that I ask him, is why, you know, LA County able to go and to test everybody for free that needs a test, that wants a test. San Diego which is roughly the same size as us, has done a much better job of testing. San Bernardino is doing a better job of testing, getting more people tested. We need to keep putting the pressure on the county. That's what I've been doing. And we're going to go and make sure that we emphasize that on this call tomorrow. But we want to make sure that everybody that needs a test is going to be able to have access to a test. We have passed legislation that nobody should have to pay for a test. I'm hearing some things about here in Orange County as well, that people are going to facilities where they're talking about they're going to bill their insurance. That shouldn't be happening. This is a capacity that needs to be built up. And you're right, I feel your frustration, right? We're focusing more on, whether people should be going to the beach or not. And we're talking about, how we need to open up when we haven't even gotten close to our testing capacity here in Orange County. And so I will continue to advocate for that. I guarantee you, I will ask that question tomorrow on the call that I am on. And, I will let you know when I talk to Dr. Chow. We'll put that information out and see what he says and make sure we will continue to put that pressure on the county, on Orange County.
Thank you again so much for your question. Tiffany, who do we have next?
We have a Jesse Latour.
Hello. Hi, Congressman. So I'm in Fullerton, and I think, as you may know, the city of Fullerton recently laid off 153 part-time employees.
Mm-hmm.
And I learned from covering city council meetings that in the latest iteration of the CARES Act, it only sends money to cities with populations over 500,000.
Right.
So my question is, are you advocating in further iterations of relief that more money can go to smaller cities like Fullerton to prevent these kinds of layoffs?
I've been advocating for our cities, our municipalities from the beginning, once we got into this crisis. I've had numerous conversations with our mayors, with our city managers. In fact, we had one just yesterday where I was joined with Congressman Pete Aguilar, who represents California's 31st district, and is also the vice chair of the Appropriations Committee, talking about the next package that we've been working on. Look, every time I talk to the speaker, she comes up to me and tells me, or now it's over the phone, but she's like, look, I know what you want, right? It's more money for the cities, more money for tribes, and to make sure that they have the flexibility to spend these resources where they see fit. The cities right now are having to make some of those hard decisions. And they're, like you said, Fullerton has laid off 153 people. They mentioned that on the call yesterday that we had with them. We need to supply them with this funding, and I've been advocating for this funding, and I will continue to advocate for this funding and continue to advocate for the flexibility for them to replace lost income from whether it be from property tax or sales tax, so that they can do this. The thing we don't want to happen is where cities spend 65, our cities right here in the 39th district are spending anywhere from 65 to 75% of their budget on public safety. Funding our police departments, funding our fire departments. We don't want them to have to cut those services. And so we are working, I'm working tirelessly on this issue. Every call I get onto, this is the issue that I bring up about how we need to support our cities and make sure that we get funding directly to them. And I will tell you this, in the package that we are working on right now, funding to our cities is directly to that. And for those cities that don't qualify for direct funding, we're leaving it open so that the funding can flow through the county, and putting in the legislation that the counties have to specifically pass this money on down to the cities.
Again, thank you so much for your question. Tiffany, who do we have next to ask a question?
We have a Jose Macias, and I'm going to go ahead and unmute you right now. There you go.
Hello, Congressman. My name is Jose. I'm a recent UC Davis graduate. And as such, I've been away from Fullerton for about 4 years, and I'm trying to figure out how to be more involved with my community in this time of need. Seeing how the market is going to be slow and we're going to contract, I think I can use my skills to help folks in need around. And so I was kind of wondering if you can point me to maybe some organizations or somewhere where I can support my local man.
Yeah, what was your degree in?
It's political science and international relations.
Okay. Yeah, well, thank you for that question. You know, there's a lot of organizations that are looking for volunteers. You know, the OC Food Bank is one of the big ones that we think. They are supplying food to thousands of people every week. They're going to have another a food giveaway at Honda Center this weekend coming up. Meals on Wheels is another great organization that is looking for volunteers to pass out meals to seniors. You know, there's other people that are doing shopping for seniors. You know, those that are afraid to leave their house to help them out. Lovefullerton.org. You know, every month every year we have that great day where it's Love Your City. Love Fullerton. Fullerton is always a big participant in that. But right now on their website, they have opportunities that are available for people to volunteer. So if none of those are working for you, you know, you can always call our office and we will make sure that we can connect you with some great organizations that are looking for volunteers. And just so you have the number, it's 714-459-4575.
Great, thank you so much for your question. Tiffany, who is next to ask a question?
We have a Catherine Stevely. I'm going to go ahead and unmute you right now. Okay.
Thank you. You actually pronounced it right, so thank you for that. I have two quick questions, if you don't mind. One is, I lost both of my jobs because of this, and my son got deployed, so he's not here to help me pay my rent. So I haven't gotten my stimulus check, and we've been in contact about that. Is that the only stimulus check that's coming, or are we getting another one if this extends, you know, into later part of the year? Because my rent is like killing me.
Right now, that is the only stimulus package that has been planned. You know, and that was a tough one to get past the Senate right from the beginning. But, you know, we are working on other things. Like we said, that the next package, we were talking about long-term relief. One of the things that we've done is the expanded unemployment insurance. I know hopefully if you lost both your jobs, you've been able to apply for unemployment insurance. So you could qualify for that. You know, I know there's been a lot of frustration with a lot of people who we've been getting these calls about. It's hard to get through, you know, the EDD. You know, it's taking too long to get my check. But you know, we've had over 3 million people here in California that have applied for unemployment insurance, and you know, those people there are working as hard as they can, and we're helping connect, you know, people around unemployment insurance with the state, local offices or state assembly offices so that they can help and support you. But if you haven't gotten your stimulus check, those are still going out. I know the first ones, you know, went out around mid-April, but right now they should be ending up the process for that. But there is a website, a portal on the IRS page, and if you have any problem looking for it, you can always call our office and we can give it to you. I don't know what it is off the top of my head, but if you go to the IRS website, there is a portal where you can look up and see where your stimulus check is in the package, whether it's been mailed yet or if it's indeed been cut, or what's going on with that.
Fantastic. Thank you, Catherine, for your question. We're going to move on to a next participant. Tiffany, who's up next?
We have David Berryman, and you are unmuted.
It's actually Beverly Berryman. I'm just on David's Zoom account.
Hi,
That's okay. That's okay.
I'm sorry.
I'll have to change that one day.
Congratulations, Beverly.
Oh, thanks. For what?
I thought I just heard you got engaged. I'm sorry.
Oh, no. I'm using my husband's Zoom account, so it has his name on there. No, you can congratulate me a long time ago. Thank you for hosting this forum. It's wonderful to hear all the stuff that's going on. My question is basically based on how California schools are funded, that schools are about to take experience major cuts to their budgets. And so I'm wondering how you'll be able to support education in the next round of the next relief package.
No, you're right. I think what was it? The governor today, I think, was talking about a $3 billion shortfall, like just in the next quarter coming up, you know, in the revenue, like through sale tax and property tax. There is going to be a hit, right? And this is another area where the Congress, the federal government is going to have to provide relief to support education. You know, I've been a big proponent of education to make sure that we continue to fund programs, we continue to fund special ed programs at the level that it should be funded at. And, you know, this is just another issue now that we are going to have to make sure that we provide this additional funding. Schools are not going to be the same way as they were before. You know, we've been in talks with educators, both, you know, through the K through 12 and at the college level, just talking about the futures of their classrooms. There's more or less students are going to be spread out. There's going to be few students in a classroom. So they're going to need more classrooms. They're going to need more teachers. They're going to need more, you know, more desks. They're going to need the resources to make this happen. And so the other thing in regards to education that I've been advocating for and we've been pushing, right, is a national broadband program there. It's to kind of make it a public utility that everybody should have access, both in our urban cities and our rural areas and everywhere around the country, to high-speed broadband. You know, so many kids right now are being left behind because they don't have that. They don't have a high-speed broadband. Schools, and even this, I had a call just the last 2 days with the president of Mount SAC and the president of Cal State Fullerton, and they're handing out, you know, hundreds of computers to college students who don't have access to a computer. To me, that's just unthinkable and unimaginable. And we have really got to modernize our educational system. We have got to provide the funding to do that. We have got to provide the funding for our schools so that they can continue educating our children once we open up. And it's going to take extra additional resources. We've already provided $13.5 billion to education in the previous packages that we passed, but more is going to need to be done.
Thank you.
Thank you, Trustee Berryman. We appreciate you joining our call. It's actually a nice segue for me to recognize briefly some dignitaries from the city of Fullerton who are participating with us today. We have the president of the Fullerton Joint Union High School District, Andy Montoya, who's on this call. You just heard from Trustee Beverly Berryman from the Fullerton Elementary School District. We also have the president and CEO of the North Orange County Chamber of Commerce, Teresa Harvey. Thank you for being here. And I believe we have the president of Fullerton Elementary School District, Jeanette Vasquez, as well. If I miss any other local dignitaries, I apologize. Again, thank you for making time to be on here. And with that, Tiffany, please let's continue and see who's next for our questions.
Great. We have a Christian Millard, and you are unmuted.
Yes. Hello, Congressman. Chris Millard here. The first or second caller mentioned what doctors and hospitals are using in terms of drugs and so on. It seems that there are a lot of doctors and hospitals for years have been using Plaquenil, hydroxychloroquine, erythromycin, remdesivir, and these kind of drugs in the early stages of the disease and for other diseases as well. What are your thoughts on this? It seems that it's been pretty effective for the early stages, but not for the moderate or late stages of it. What are your thoughts on that?
Well, look, I'm not a researcher. You know, I'm not a doctor, so I rely on the information that they're providing to us. You know, like I said, I was on a call earlier today where we were talking about some of the research that DOD has been doing, and they're, you know, both working on a vaccine as well as a treatment. So when it comes to these treatments, I'm not going to tell you one way or the other, like, you know, I think this one is doing better or this one is the solution. I am relying on the research and the information that I get from the experts. And I know from what I can tell you is that they are working tirelessly on finding both a treatment for the COVID-19 as well as a vaccine. And so the federal government, Congress has really supported this research. We made sure that we provided ample funding to this. And we will continue to do that as long as it's needed, right? This is something that needs to happen. We need to find a treatment. We need to find a vaccine. And I know there's been some talk of different drugs have been performing better than others, but you know, we're still in the early states of research, and we need to make sure that this research continues and that it's funded so that we can get to completion.
Thanks.
Thank you so much for your question. And just want to announce two more folks, dignitaries from Fullerton that have joined that are on our call. And that's Joanne Foley from Fullerton Joint Union High School District. Trustee Foley, thank you for being with us. And Trustee Marilyn Bucci from Fullerton Joint Union High School District. Thank you for joining our call. With that, Tiffany, who's next on deck for a question?
We have a Richard Gayton, and you are unmuted.
Thank you. Hey, Gil.
Hey.
Thanks for having this meeting. Appreciate it. I was so relieved when you were elected. This is really cool. And I'm so proud of our national legislature to react quickly with a lot of support. I don't know if it's enough. It's so hard to tell. But here's kind of a contrary question, and because I can't answer it myself, is we've got to borrow a tremendous amount of money to do what we need to do to survive here. I know the federal government is doing that. And it seems to be almost a philosophical question. How much does that matter? I mean, how much does it matter how much we go into debt here? Mm-hmm. I know we've got to do it. I'm just wondering, you know, whether it matters, I guess. That's my question.
Well, you know, it does matter. And at some point, you know, we're going to have to look at this, right? But the alternative right now would be doing nothing. And we got to look at how devastating that would be to human life. We need to do what we can. Health and safety, and I've always said this from the beginning of this, we walked into this, everybody's health and safety has got to be our top priority. It's the number one thing that we have to focus on. And, you know, that's why we've kind of been put in this situation right now where everybody's had to kind of shelter in place and follow the CDC guidelines. I don't agree with people that are out there protesting, saying that we need to sacrifice individuals. You know, I think we need to do everything we can to make sure that we find a vaccine, that we find a treatment, and we do everything we can do to be responsible to make sure that we save as many lives as we can. You know, even as far as the debt goes right now, even the president's saying, well, it doesn't really matter that much. You know, the debt's not really that important. And you can find economists that will argue on both sides, you know, that, well, it is important, or well, it's not really important. But I think right now, you know, everybody's health and safety has got to be our top priority. And then we have to do everything that we can after that to ensure that the economy stays in place and that we keep everybody gainfully employed as much as we can. And those that haven't been able to stay employed or lose their jobs, that we keep providing them with financial support, which we've done through the expanded unemployment insurance and through the PPP program, to go and to really to help them out financially so that we can get through this. The only way we're going to be able to get through this crisis first is to focus on health and safety. And then once we do that, then we can really start focusing on growing the economy again and doing what we need to do to get out of this and get out of this debt. But, you know, this is something right now, these are not normal situations. These are not normal circumstances that we're living under right now. Never in my life did I think we would ever be in a situation where we would have to kind of stay in place, and this a disease, a virus, would be basically closing down our economy. It wasn't something that I perceived 2 years ago when I was running for Congress, but it's a situation that we're dealing with right now, and we're doing the best that we can to deal with that, and to really make sure that we provide for the health and safety of every individual, and doing what we can to protect the economy and everyone's jobs, so that we can move forward once we find that vaccine and the treatment to get back to normal.
Great, thank you so much for your question. Tiffany, who's next?
We have a Larry Blotcher, and you are unmuted.
Hi, Gil. I've got a question regarding the PPP loan. Right now, you only have 8 weeks once you receive it to spend it. And I know there's a proposal to expand it to 12 or 16 weeks. Well, I got the money recently, so I need to know sooner rather than later if I can spread this out over more than 8 weeks, which would be beneficial for my employees and my company.
That's something that we're working on right now in this next package. That's a thing that we're looking to fix. When we passed these stimulus package there with the CARES Act, or what it was with the PPP program, we didn't have any idea how long this was going to last, or really what the situation was going to be like 2 months from now when we pass this legislation. As we're finding out, it probably is going to last longer than we initially thought.
Well, but what's your best guess as to when you think at least that issue will be decided? Because like I said, if you let me know 6 weeks from now, when I only have 2 weeks left and I've already spent the majority of the money, that's of no help.
I'm hoping that it'll be done. We'll have a good answer for you in the next 2 weeks. And I know this is part of this is part of the next package that we've been talking about, is extending it out. And Chairwoman Velasquez, who chairs a small business committee, has been talking about dragging it out to where it would be out till the end of the year, to really kind of give you a gap, an extended amount of time for you to get everything back in order. But hopefully within the next 2 weeks, we will have an answer for you, and it'll be part of the next package that we're passing. But that's an issue that I know has bipartisan support, because we don't want to see any of our small businesses suffer into that.
Great, and thank you so much for your question, sir. Tiffany, who do we have next?
We have an Alexander Rayburn. I'm going to go ahead and unmute you right now.
Hello, how's it going, Congressman? I was wondering if we had a plan in place for a compensation of loss of doctors, medical workers, because it takes, of course, many years to train, going to medical school, university. Do we have some kind of backup plan or a future plan to expediently have more doctors available? Do we plan to import them, perhaps?
Well, even long before this pandemic started, I had been advocating, that we need to do a better job of funding med school as well as nursing school, because we are facing a shortage of doctors and nurses. There's a lot of individuals that, dream of going to med school. They want to go to med school, and then they look at that price tag of hundreds of thousands of dollars and decide to go and to do something else. We need to do a better job of funding medical education, to making grants available, to giving them the opportunity to, whether it be join the military, or to go, become a doctor, or to go and, do community service at a health clinic in areas, whether they be urban or rural areas that need medical they need doctors, or they need nurses. This is something that I've been advocating for a long time, and I continue to advocate for that now. Chrissy Houlihan, who's one of my colleagues from Pennsylvania, has legislation right now to incentivize, more people to become public healthcare workers. And that's something I've co-sponsored and that I support. There's also talk of legislation right now from a colleague in Florida, Debbie I always say her name wrong, but Massaque Powell from Florida, who wants to make it available for those who might have practiced medicine in a foreign country, who are licensed to practice medicine in a foreign country, but are now here living in the United States, where we can expedite them so that they could become and start practicing medicine here to help out with this coronavirus. And so these are two good pieces of legislation that I've supported. And I will continue to advocate for better programs that will make it more economically beneficial for individuals to go to med school, so they don't have to mortgage the rest of their life in order to get through there. Because, pandemic or not, whether this pandemic happened or it didn't happen, we would still be looking at a shortage of medical doctors and nurses in the medical field. And that's something that we need to look at for the long term and really need to make some changes of how we're doing things here in the United States.
Great, and thank you so much for your question, Alexander. Appreciate it. Tiffany, who do we have next?
We're gonna go with Dave Rode, and you were unmuted.
Thank you, Congressman. Just a question. We happen to be members of the No Labels, which supports the caucus of the problem solver. And I just wondered if you're finding more interest in bipartisanship to get things done where, we don't have the top guys making all the decisions, but Congress is actually making decisions that help all of us.
No, the Problem Solvers is a great caucus made up of both Democrats and Republicans who come together and define issues that they can work together on. And really, it's one of those caucuses that I think is really doing a lot of that great work. I believe in bipartisan work there, and I've been doing bipartisan work. Over 60% of the bills that I've co-sponsored have been bipartisan bills. I've actually sent out a letter today that we've been working on with Representative Bacon, asking the DOD to invest in small businesses to create, or not to create, but to really to help build up our national stockpile, that they need to make contracts with our small businesses around the country so that we have a national stockpile of PPE and swabs and everything, ventilators, all these items that we had a shortage of, that, that we make sure that the next time we have this going. I'm part of the Four Country Caucus, which is a bipartisan caucus of veterans, both Republicans and Democrats, working together, on the same thing, working on issues where we can come together on, really around veterans and defense issues. I've attended several of the No Label meetings where we get members of the House and members of the Senate from both the Democratic and the Republican Party working together to talk over issues. I will continue to attend those meetings once we get back to Washington, but and I've even joined some of those on conference calls. But I believe in bipartisanship. I've been working hard with my Republican colleagues during this time to make sure that we pass bills. Just yesterday we announced a bipartisan bill with me and Democratic member Pappas, with Republican member Fitzpatrick, and a Republican member Stubbe, talking about how we need to provide additional support for nonprofits, those 501c6s that are chambers of commerce that are so important to our communities, especially during a time like this. So I couldn't agree with you more, right? That bipartisanship is very important, and it's something that I focused on to make sure that I find issues where I can work on with my Republican colleagues, and I will continue to do that.
Thank you so much for your question. We have time for about 2 more questions. With that, Tiffany, who's next?
We have Michael Jeffrey Glick, and go ahead.
Hi, thank you so much, Congressman, for being here today. You know, Mitch McConnell is insisting on immunity for liability for businesses as we reopen. And yeah, tort reform has been a long-term goal of the conservatives. And now, no one wants to see frivolous litigation, of course, but tort law is the one protection that consumers have against greedy corporations who put profits ahead of people. I worry that in the rush to bring a vaccine to market, it may lack adequate safeguards. Without the threat of liability, the corporations that regularly push a lot of defective drugs into the stream of commerce, and this is something that you know is within a line of business that I do, so I know something about this. They won't be deterred, and we may end up with a lot of injuries and not as much good as we're hoping for. Tort law is the one thing that keeps regular people safe. So, and especially as you know, the Trump administration has weakened our consumer protection overall. We need to have remedies. Is it a priority of yours and in the House to assure that we don't allow our current crisis to allow proponents of tort reform to sneak legislation in that's going to end up weakening consumer protection?
No, the Senate has tried to sneak this into the last 2 packages, and both times, you know, in the House, we didn't allow that to happen. I couldn't agree with you more. We don't need to be waiving a liability for these companies. We need to make sure that they are, in fact, you know, whether it's making products, that the products are made right. And also, you know, the other thing is, right, as we get back to this, you know, to opening up businesses, right? We need to make sure that the businesses are opening up safely and that their workers are going to be safe there and they're doing what's right. You know, one of the things that I've also been pushing around this as well is that OSHA needs to make sure that they provide the regulations for these businesses to open up safely. And right now is not a time, you know, to be going into waiving liability for corporations. You know, if anything, I think this crisis has highlighted, you know, what we need to do to protect human life, you know, and really to make sure that, you know, what really the things that we have seen is really the disparities amongst the different communities, really, you know, those that are living in underserved communities, whether it might be Latino or African American, and how they're dying at a higher rate than those that aren't from those communities. And so we need to make sure that we do what we can to protect the American people. And I don't think waiving liability is one of the things that will do that. So I couldn't agree with you more, and it's something that we need to continue to protect. And I can guarantee in the House of Representatives, that's what we've been doing.
Great, and thank you so much for your question. With that, Tiffany, this is our final question. So let us know who's next.
We have Jan Bloomfield, and you can go ahead and talk. You're unmuted now.
Hi, I was wondering, on your earlier conversation, you said you had mentioned that you wouldn't want a doctor's office to bill an insurance company for the COVID testing. Why is that?
Well, no. So we passed legislation very early on that all testing, COVID testing, is free. That was one of the first bills that we done. So anybody who needed a test, who had to go get a test, that test would be done for free. One of the things that we're finding out here in Orange County, which has really been lagging in the testing, is that more and more facilities are opening up that are charging individuals to go out and to get tested. You know, the funding, like I said, in the last bill that we passed, we provided over $25 billion to increase testing. Testing should already be free. In fact, Orange County has received nearly $1 million for them to do testing and to test individuals. So
I understand why you wouldn't want someone to have to pay out of pocket for testing. But
right.
if their insurance company covers it, why shouldn't the insurance company pick up the bill instead of the taxpayers?
Well, you know, this is a thing that one of the things that we made available, and it's already been in the bill. So every individual that should have it should be able to get that done. You know, it's something that it should be, it's out there for everybody that needs it. And it shouldn't be something that's going on and being passed on to the insurance, because what's happening is the county is already getting the money to do the free testing. And that's happening all over the country. All these public, you know, county departments of health are receiving the funding so that they can conduct the free testing. So why should they have to go out there and charge these individuals, whether they charge the individual or they're charging the insurance company? They're basically double charging. And so that's what we want to prevent, right? If we've already provided the funding for this so that the departments of health can go out and conduct the test, nobody should be billing an insurance company for testing.
Great, and thank you so much for your question, Ms. Bloomfield. Congressman, floor is yours for closing remarks.
Well, I just want to thank you all for being here today and you know, taking time out of your evening to come and just listen to me. Hopefully we were able to answer your questions. We tried to get as many as we could to in this hour, but if we weren't able to get to your question and you still have questions, again, I welcome you to email us or to call my office, and I'll give you the number here once again, 714-459-4575. We are answering every email. We are answering, you know, returning every phone call. So please, if you have any additional questions or if there's information that you need or you're looking for resources, you know, as you know, the one gentleman was looking for good places where you can go volunteer, definitely give us a call and we will, you know, point you in the right direction. But before I close, I just want to remind everybody, you know, there's something very important going on, and hopefully you all received it in the mail, but the census is still taking place. And if you haven't filled out your census form, they extended the time period because of the COVID-19, the coronavirus crisis that we're going through right now. So you still have time to fill out your census, but please get that done. It's very important to make sure that we get every person in our district counted, every person in our state. California is already looking at the possibility of losing one seat in the House of Representatives. We don't want to lose two, but more importantly, we use this data to figure out where federal dollars are going to be spent and how we're going to fund education, you know, how we're going to fund, where we're going to put those police departments, where we're going to build that new fire station. All those decisions are made using census data. So please fill out the census. You know, I do, you know, like it should say too, right? It gets done very quick. It only took me about 10 minutes to do mine. And so please make sure you get that done. But again, I just want to thank everybody for being here. You know, make sure you follow the CDC guidelines. Make sure you're washing your hands. Wear a mask if you're going outside, if you're going to be walking around. I know places are really, like we said, we're entering phase 2, where some retail outlets like bookstores are starting to open up. You know, restaurants are going to start preparing how they can start doing services, you know, in the later phases. But please, if you don't need to go out, don't go out. If you don't need to go to a bookstore, don't go to the bookstore. But please continue to practice the safe social distancing and practicing and following the CDC guidelines. And I just really want to thank you all for being here today and for joining me. And you know, hopefully we can do this again very soon. And we will talk to you all later, and take care and make sure you stay healthy and stay safe. Thank you very much.